Hey everyone, it's Sarah here from Plan A. Today I'm joined by Murray, James, and Nikki. Today is another episode of our mini series of podcasts in support of mental health for Bell Let's Talk. Hopefully, you heard our previous podcast discussing depression. Today, we're moving on to a new topic, and we're going to be talking a little bit more about bipolar disorder. All of the information we are going to discuss today, we have done extensive research, and we're going to be providing the links and information to get support or any type of help you might need in regard to any mental struggles that you may be faced with during this time. So we're just going to have a little bit of a discussion here, and hopefully you're able to learn something new or find support where needed. So for bipolar disorder, it is a mental illness marked by extreme shifts in mood. Symptoms can include extremely elevated mood called mania. They can also include episodes of depression. People with bipolar disorder may have trouble managing everyday life tasks at school or work or maintaining relationships.
There are actually three types of bipolar disorder: bipolar 1, bipolar 2, and cyclothymia. Bipolar 1 will present with at least one manic episode. People may experience hypomanic or major depressive episodes before and after the manic episode. Bipolar 1 affects men and women equally. Those with bipolar 2 disorder experience one major depressive episode that lasts 2 weeks or longer. They also have one hypomanic episode that lasts about 4 days. Bipolar 2 is thought to be more common in women. Cyclothymia will see people affected with hypomania and depression. The symptoms are shorter and less severe than those in bipolar 1 and 2. Most people with cyclothymia will only experience a month or two at a time where their moods are stable.
Bipolar disorder is difficult to diagnose in children as it doesn't present the same way and can often present with similar symptoms to other conditions such as attention deficit hyperactivity disorder or ADHD. Bipolar disorder basically makes people experience extreme swings that can be related to ups and downs in their mood. The up is the hypomania stage and down is depression. Although not everybody who experiences the down in bipolar feels low enough to be classified as depression specifically. It's not really clear what causes bipolar disorder. There's not any one thing that it can be attributed to. Many different factors can trigger bipolar disorder, such as brain structure, brain chemistry, as well as environmental factors on the individual suffering from the disorder.
There is research to show that bipolar disorder can be passed from parent to child. People are 4 to 6 times more likely to develop bipolar disorder if they have a family member that already has it than those who don't. But it is important to know that this doesn't mean if you have a relative who has bipolar disorder that you're going to get it. And it also doesn't mean that people who have bipolar disorder, but they may not have any relatives who have it at all. They could be the first one in their family. So it's not a guaranteed thing.
Bipolar disorder is typically treated with medication and psychotherapy. Mood stabilizers are typically taken, and it can be for a long time. The main stabilizer that is taken is lithium, but it does have side effects, including low thyroid function, joint pain, and indigestion. If you take lithium, you also have to have regular blood work as it can cause issues to your kidneys.
If you are diagnosed with bipolar disorder, then there is no cure for it. But you can manage it with proper treatment and support from family and friends. It does mean a change in certain lifestyle choices, including alcohol, drug use, exercise, diet, sleep, and stress reduction. There's lots of supportive groups for people who suffer with bipolar disorders. And I think, as we mentioned already, we will put those up on the screen for anybody who wants some support. I do have a friend who has bipolar disorder. He is a really great guy. He's been posting. He's very popular with putting all these posts up and stuff. He's posting a lot in Britain, and he's doing some great jobs with it. And I took a piece of one of his clips just so I could play it for people who might need support, because there's nothing quite like hearing someone who is going through it, telling you and giving you some support. So I'd like to just play that for you now.
Will get better. It can get better. I'm living proof of that. And if you do know somebody that is suffering with this right now, there will be loads of them. please do just pick up the phone. They may not want to speak to you, but you know what, they'll know the sentiment is there, that the feeling is there, and eventually it'll come out of it. But please do pick up the phone or go for a walk with them. Obviously, be safe in these COVID times. But yeah, just reach out like people did for me.
He talks about how just getting out of bed in the morning is just not something you're able to do when you're suffering from bipolar disorder. And they may not want to speak to you at that moment in time, but they will know that you are there for them. And that is just a big enough thing for anybody who's suffering through it. So I think it's really important just to share a great little piece of information from somebody who does have bipolar disorder. So we would like to take you through some of the top facts to kind of take away from this session. So one interesting thing about this, which I didn't know until we researched this, is you can feel mania and depression at the same time. Bipolar disorder symptoms usually go back and forth between the highs and lows. During a high, you might feel extremely energetic. You may be anxious and not be able to sit still. A few weeks later, you might feel exhausted and sick. You might not be interested in all that much. That's a depressive episode. However, sometimes people feel symptoms of highs and lows at the same time. Other names for this are mixed mania and a mixed state.
Anyone can get bipolar disorder. It often runs in families, though. Experts think that something in your genes can cause bipolar disorder. Sometimes something very stressful or a big life change can trigger bipolar disorder. Losing someone you love is an example of this circumstance. People with bipolar disorder also are more likely than others to have certain healthcare problems. These include obesity and heart disease, among others.
Bipolar disorder can also affect children. Most people show signs of bipolar disorder at about age 25, but it can strike at any age. It can even occur in children and teenagers. It's often hard to diagnose bipolar disorder in children. Children with bipolar disorder may have severe, violent fits for a long time and then act extremely happy at other times. Teenagers may make choices that are dangerous. Their grades may drop, or they might stop sports or activities that they once used to enjoy.
Symptoms can also worsen during pregnancy. Women are more likely to have an episode of mania or an episode of depression during pregnancy than at other times. The risk is even greater for a few months after childbirth. Changes in hormones, being stressed, and not getting enough sleep probably trigger bipolar episodes in pregnant women. Skipping treatment can make these episodes more likely.
Both manic and depressive episodes can put you in great danger. Times of depression may trigger thoughts of suicide or harming yourself. In these moments, it's important to seek assistance from those close to you or professionals that can support you in the proper manners. Times of mania can also be very dangerous. People often behave recklessly and make dangerous choices. They might use drugs, spend too much money, or have unprotected sex. This can have a bad effect on their finances, health, and relationships, of course. It may also lead to potential legal problems in the future as well.
One thing that can help people is a healthy lifestyle. A healthy lifestyle can help keep bipolar disorder in check. Medicine and therapy can help even out your moods and control symptoms of bipolar disorder. It's important to practice a healthy lifestyle, for example, getting a regular exercise, figure out how to better manage your stress. Yoga and meditation might be helpful, for example. Get plenty of sleep every night. Lack of sleep can trigger bipolar symptoms. Consider joining a bipolar disorder support group that might be able to help you stay on track with your healthy choices.
You'll always need to treat your bipolar disorder. You can't treat bipolar disorder once and be done with it. It's a lifetime condition such as multiple sclerosis. That means lifetime management. Follow your treatment plan and live a healthy lifestyle, even when you feel healthy. Many people live well by keeping their bipolar disorder under control. Know that your medicine and therapy may need to change over time. However, never change your treatment plan without first talking to your doctor.
Well, that brings us to the end of our chat here on bipolar disorder. Thank you to my colleagues again, James, Murray, and Nikki. That was a great, informative conversation that was definitely very important to have. So I hope everybody learned a little bit or is able to gain some support through this conversation or any of the information that is provided. Stay tuned for the next episodes we have coming up for our mini podcast series regarding mental health. And follow us on all of our social media. Thank you so much, guys.